Odontogenic infections are infections arising primarily from the tooth, and this occurs as a result of intraoral bacteria gaining access to pulp via dental cavities, such as a carious lesion, and the pulp undergoes necrosis and an abscess collects at the tooth apex over time. The symptoms are pain on chewing, jaw swelling with persistent gnawing pain, fever, and chills. And the signs that are usually elicited as tooth tenderness, supercession, and lymphadenopathy. Investigations are X-ray of affected tooth. The main treatment objectives are to control infection, to control pain, to remove source of infection, and to restore tooth integrity and function. Non-pharmacological treatment: roots canal therapy with drainage, debridement, episectomy, and also restoration of structure and function. Pharmacological treatment: for the treatment of mild infection, first line treatment, you give amoxicillin oral in adults 500 milligrams 8 hourly for 7 days. In children 5 to 18 years, you give 500 milligrams 8 hourly for 7 days. In 1 to 5 years, you give 250 milligrams 8 hourly for 7 days. 1 month to 1 year, you give 125 milligrams 8 hourly for 7 days. For the treatment of mild infection, in patients allergic to penicillins, give doxycycline oral in adults 100 milligrams 12 hourly for 7 days, and is not recommended in pregnancy, lactating mothers, and in children less than 8 years of age. For treatment of severe infection, first line treatment, you give amoxicillin clavulanic acid oral in adults 625 milligrams 8 hourly for 7 days, and in children more than 12 years, give 50125 tablet 12 hourly for 7 to 10 days, and 4 to 12 years, you give 5 milliliters of 457. That's a drug combination of amoxicillin clavulanic acid oral suspension 12 hourly for 7 to 10 days, and 1 to 4 years, give 5 milliliters of 228 suspension 12 hourly for 7 to 10 days. 3 months to 1 year, give 20 milligrams per kilogram of amoxicillin 12 hourly for 7 to 10 days. Less than 3 months, give 15 milligrams per kilogram of amoxicillin 12 hourly for 7 to 10 days, or I give azithromycin oral in adults 500 milligrams daily for 5 days. In children, it's not recommended for children less than 6 months, but because of the risk of pyloric stenosis, and more than 6 months, you can give 10 milligrams per kilogram body weight daily for 5 days. For the treatment of severe infection, in patients allergic to penicillins, you give azithromycin oral in adults 500 milligrams daily for 5 days. In children, 10 milligrams per kilogram body weight daily for 5 days, and it's not recommended for children less than 6 months because of the risk of pyloric stenosis. Or you can give clindamycin oral in adults 150 to 300 milligrams 6 to 8 hourly for 7 days. In children 12 to 18 years, give 150 to 300 milligrams 6 hourly for 7 days. 1 month to 11 years, to give 3 to 6 milligrams per kilogram 6 hourly for 7 days. For pain relief, give paracetamol oral in adults 500 milligrams 1 to 1 gram 6 hourly as required. In children 6 to 12 years, to give 250 to 500 milligrams 6 hourly as required. And 1 to 5 years, to give 125 to 250 milligrams 6 hourly as required. 3 months to 1 year, you give 62.5 to 125 milligrams 6 hourly as required. Refer all patients with odontogenic infections to a dental specialist after initiation of treatment.